Well, we are 2 minutes past the top of the hour, so let's go ahead and get started. You're attending today's Implementing a Self-Measured Blood Pressure program in the clinic setting, session 6, which is focused on tools and resources. And my name is Elena Smith. Today's objectives will focus on data expectations, patient-facing resources, and staff-facing resources. So let's get started with those data expectations. So these are some of the things that we recommend tracking once you implement your blood pressure, your self-measured blood pressure program. So we recommend tracking, of course, the number of patients enrolled, just so you can see how much of your population that you've been able to reach with your self-measured blood pressure program. We also suggest looking at hypertension prevalence, which would look at the numerator as the adult or 18 to 85-year-old patient population with hypertension, and the denominator being your total adult patient population. So putting those together would give you that hypertension prevalence. And then we also recommend looking at the controlling high blood pressure measure, which is also known as NQF18 or CMS 165. And that one, the numerator for that is the number of adult or 18 to 85-year-old patients with a diagnosis of hypertension and whose blood pressure is adequately controlled at less than 140/90. The denominator for the controlling high blood pressure measure would ideally match the numerator of hypertension prevalence, because it should be your adult or 18 to 85-year-old patient population with hypertension. So your total hypertensive population would be the denominator, and your numerator would be those that are considered controlled. We suggest looking at that data quarterly and just keeping track of what you're seeing and how things are changing. And what you can expect with some of those numbers is that initially your hypertension prevalence will likely increase due to identifying new hypertensive patients. Once you're sending patients home, maybe they have that masked hypertension, which we've talked about, which is when your patient is actually in your office, they aren't showing signs of hypertension, but when they're at home, they do have that elevated blood pressure. So you're going to kind of identify patients through that, which will help, or which will make it so that hypertension prevalence actually increases. And then on the flip side, your controlling high blood pressure should also increase over time, because your previously uncontrolled hypertensive patients, or your newly diagnosed hypertensive patients, will have their medications titrated, and they'll get additional support that they need so that they can get their blood pressure in that adequately controlled range. So these are some of the things that you can expect to see as you track your data over time. So some of those measures that I spoke about, including controlling high blood pressure, that NQF18 is a merit-based incentive payment system, or MIPS measure. So if you are tracking that and you're seeing some really great success with this SMBP program, you can definitely select that as one of your MIPS measures to report on. And that's also within the Minnesota Community Measurement List for 2021, is that controlling high blood pressure. So can kind of help you with both of those programs. I also wanted to point out that engagement with a QuinnQIO to implement self-management training programs is a medium-weighted improvement activity within MIPS. So for those of you who joined us during this, you can select that as an improvement activity through MIPS. And the use of certified EHR to capture patient-reported outcomes is also a medium-weighted improvement activity within MIPS. So you have some options there that implementing a self-measured blood pressure program can help you with some of the things that you are likely already reporting on. So now let's hop into some of our resources, and I'll be sure to send our participants all of these resources in a follow-up email after today's session, so you have access to all of them, including all of the recordings from these this 6-week session. The first one is a newer guide, and this is a 7-step SMBP quick guide through the AMA. And it just walks you through each step of an SMBP process, identifying patients for SMBP, confirming device validation and cuff size, and training patients, for example. So I've included that here for your reference, along with the link there down at the bottom for you to check out. There are also great SMBP tools that are all that are already created, like a loaner device tracking sheet or a loaner agreement. The loaner device tracking is located here at the bottom. It's a way to keep track of where your devices are and who they're with. And then the loaner agreement program kind of just goes over who has what device and kind of what the expectations are. It's a place that you could put information on what and how often you want the patient to measure, so that they have that at their fingertips at home. Some other tools that are available to you right online are the device accuracy test. So we went over that a few weeks ago. The patient training checklist. This is a great checklist to use in the first few weeks of implementing your program. Eventually your staff members will get more used to all the things that are on the checklist, and hopefully you don't have to use it a lot often. Staff competency, I can include some slides on that. We always want to remember that when we are taking patients' blood pressure in the office, we want them to model what we're doing. So it's really important that staff members are competent with taking blood pressures in the office, so that when patients go home, they're doing it the same way that they watch their clinical staff do it in the office. So we really, really want to make sure that that translates over well. And then finally, some SMBP research articles. So if you do have some issues getting some clinician engagement, this is a great way to show them that this is evidence-based and it's supported by research that shows that this is an effective way to help control high blood pressure. This handout guides you through training a patient to determine the appropriate cuff size. This could be really helpful when providing monitors to patients without an in-person visit. So if you're sending anything out via mail, or if a patient orders the monitor or anything like that, this handout can help a patient do this on their own at home. Despite the strong evidence base for SMBP and its endorsement from the national healthcare leaders, uptake of SMBP in the United States remains low with a lack of third-party reimbursement. It's cited as a key barrier to its use overall is that there's this lack of coverage and reimbursement. What's linked here is an analysis that confirms that coverage of home blood pressure monitors and SMBP clinical support services was extremely limited across payers. So this is another thing just to kind of show you that this is something that is a hot topic, and we can likely see this moving to the forefront and getting more insurance coverage over time, because it is getting a lot of research put behind it. And there is this push to allow for more coverage. There are also several COVID-19 focused resources. I've linked one here. This one really talks about COVID-19 and cardiovascular disease, and this particular one is a partner activation toolkit. It does include some great video PSAs and graphics that you can utilize within your clinics as well. The Release the Pressure campaign is another great campaign that brings together a diverse coalition of healthcare organizations. The Release the Pressure Heart Health Squad. They're dedicated to partnering with the Black community to improve heart health. Their mission is to partner with Black women to take preventative action to protect their heart health and be part of a movement for healthy blood pressure, the leading risk factor for heart attack and stroke. So this includes a pledge that your patients could sign on to set a blood pressure goal with a healthcare professional, monitor their blood pressure at home, activate their wellness plan, and check in with their squad. So this is a great other opportunity that you could enroll patients in that you could kind of couple with SMBP. This is from the Million Hearts Blood Pressure Protocol. It shares some evidence-based strategies to aid efforts at hypertension control. So this is a great thing to look into, to share with your clinicians, so they can kind of see what how SMBP kind of fits in with hypertension control. We also suggest that all clinics that choose to implement an SMBP program, they check out and ensure that SMBP is somehow worked into their blood pressure protocol. So this example is something that you can use to create your first protocol. This one is clickable, it's printable, it's editable, and it's already kind of created for you. So this flow chart looks at both stage 1 and stage 2 hypertension, talks about systolic and diastolic thresholds, follow-up time periods, recommended medications, and prompts to advise patients on self-monitoring and adherence. So this is a great place to start and to look at how maybe you can incorporate SMBP into your own protocol. So maybe you already have something and you don't want to change that because it's working really well, but maybe you can check this particular resource out to see how SMBP is fit in with other protocols. And then this is something that I actually haven't had as much time to digest because I actually just got it today, but this is the publication from the National Association of Community Health Centers, and it looks at are community health center patients interested in self-measured blood pressure monitoring, and can they do it? So this is a brand new report. I wanted to include it so you had access to all of the latest and greatest. So I highly suggest checking this out and seeing what their findings were. And then lastly, in terms of specific resources, lifestyle changes to manage high blood pressure. So these are just some things that you can easily explain to patients about ways that they can change their lifestyle to help manage their high blood pressure. One that you do want to highlight, because it might not be as obvious, is that reduced alcohol consumption. So alcohol can actually temporarily raise blood pressure due to caloric consumption and physiological responses to alcohol. And actually long-term consumption can have damaging effects on the liver, digestive tract, and vascular system, which leads to elevated blood pressure levels. So heavy drinkers who cut back on moderate drinking can lower their systolic blood pressure by 2 to 4 millimeters of mercury and their diastolic blood pressure by 1 to 2 millimeters of mercury. So highly suggest kind of educating your patients on things like that. This is a great thing to maybe print off on a card to give to patients so that they can easily remember some of these ways that they can change their lifestyle to help manage their blood pressure at home. YMCAs are also getting involved in self-measured blood pressure. If you want to check out what your state has to offer, I've linked all 3 of our Superior Health member states and their blood pressure self-monitoring program. They kind of flip what they call it. But I highly suggest checking this out. It's a great way to couple what you're doing in the office with some of those feedback programs. So the YMCAs not only look at blood pressure, but they'll talk to your patients about nutrition and other things like that. And some of them even offer free Y memberships if you enroll in their programs. So I highly suggest checking that out and seeing that there's a way that you can partner with the YMCAs in your area to refer patients to them to get that holistic care that can hopefully help manage their blood pressure as well, outside of just what you're able to do within your clinic. And as I mentioned, I did get some new resources just today, so I wanted to share those as well. The first one is the Million Heart Self-Measured Blood Pressure Monitoring Forum. This one, I just got the registration link for today. It does, the first one does occur on March 11th, so next week. This is a great thing. They will be talking about automatic home blood pressure monitors and their coverage, as well as SMBP services. So if you're interested in learning a little bit more about that, I highly suggest checking out the forum. When you do go to register, you can even include some of your own questions that they'll hopefully answer during the forum. So I highly suggest doing that if you're looking for more answers. Million Hearts is definitely the expert in self-measured blood pressure programs. And then lastly, the American College of Preventive Medicine is hosting a webinar on March 17th that's titled Guiding Your Hypertension Improvement Journey, a Practical Approach for Busy Healthcare Teams Engaged in Quality Improvement. So that's another great opportunity to see how you can incorporate quality improvement right now when we know that things are so focused on COVID and everyone is so busy with COVID right now. So this is another great opportunity to kind of gain some perspective from the American College of Preventive Medicine. So with that, I will open it up for any questions. All right.
Yeah, I was just going to say, Elena, can I share one thing too?
Yeah,
For those clinics that are part of our community coalitions work, we are actually, hypertension is one of the measures too that they can report on for improvements. So, and it is the NQF18 measure. So just wanted to add that as a added bonus too. If they're reporting on that measure, they can use it for the work that we're doing for our QIO work.
great point. Thanks, Jerry. And yeah, that'll be something that we're able to kind of, we'll be tracking that along with you when you send that information on to us, and we can kind of, we'll be focusing our work on some of the data that people send in to us. So if we're seeing that there needs to be more assistance with how to raise that NQF 18 controlling high blood pressure measure, we'll be creating education directly surrounding all of that. So great point, Jerry. Thank you so much. Well, with that, I think we can end today's call. So thank you all for joining us today, and we look forward to future educational opportunities. We appreciate everyone for joining us for this 6-session series on self-measured blood pressure. Thanks, everyone.